behind the scenes in the Living Spaces green room.
And here in just a couple minutes, we are going to start with the nose job on your face. Are you ready?
Yes.
No scalpels needed, but we're going to change the nose here in just a moment.
During the show.
During the show.
I would love that.
Okay, good.
Thank you.
Now,
make it. Yeah.
we've been talking about this nose job thing in 45 minutes, a nose job in 45 minutes.
No
Dr.
surgery.
Stanley Jacobs, the well-known Bay Area guy, is here right now. And what are we talking about 45 minutes?
Well, Dr. Jacobs, you can explain it, but basically we're going to correct a problem and then make her look younger. No scalpels involved, right?
Right.
What?
So basically this is
What does that
Kendra,
mean?
and she's a great person to have here, but she has a little bit kind of a swoop this way here that kind of drops down a little bit.
This would have been from a previous nose job.
She
It
had-
loses the support and then it drops down,
Yes,
right?
exactly. So this is the bone, there's the cartilage, it kind of drops down a little bit here, and it's a little bit irregular here. But what we also want to do is make this smoother, so a little symmetry and balance.
Okay.
But you also want to put a little bit in here, so we want to have this effect.
Down here.
See how that lifts
And
that
that
up?
will lift the nose.
And that will lift the nose.
And that's the anti-aging
And that's
part.
the anti-aging part, because this angle between your nose and your lip is, right now, there's 90 degrees. You raise that even a few degrees, you lose like 10 years.
Wait,
Okay,
so your nose can age you?
Yeah.
I had no idea.
Yes.
Yeah.
One more thing to
as
worry
soon
about.
as it droops, you can lift it up, and that's what's going to be great. You're gonna love
So
that.
you're going to do with injectables, and the difference now is that you're using what and it lasts for how
I
long?
have never ever heard
It's called
of
Juvederm,
a nose job
and
like
it's
this.
a material that's called a hyaluronic acid. And a hyaluronic acid is something that's in your skin already, so you don't need to be tested. So it's really cool. And it's a needle, as you can, it's clear. And so you inject it, and there's a little bit of swelling, and it only takes a few minutes to do it.
Lasts how long and costs
Well,
how much?
It costs about, per syringe, about $700. But the longevity part is, it's like building a house. If you do the first injection like today, 2 months later to 3 months later, you do a second little bit of injection. It's like building then the house structure. Then it lasts for a year, only come in once a year for a touch-up.
And it would be $700 a year?
$700 per syringe.
syringe.
So
But the touch-ups wouldn't be that much.
it could be.
Could
It
be.
depends on how much you need.
So you got to keep it up.
Yeah.
So we're going to let you start drawing on her, and then we'll
Yeah.
check back at the end of the show. We'll have our befores that we just took and our afters.
Excited?
Are you
Yes.
nervous?
No, I'm super excited.
You've been wanting to do this.
I've been wanting to do this, and he's such an artist. I know that he's just gonna really.
Okay, so this is all going to take place. We're going to
can't
go to
wait.
commercial break here in just a moment. Dr. Jacobs and Kendra will be back,
through
and
here.
we'll watch the transformation.
All right, work your magic, Doc.
I
Thank
will.
you.
Thank you.
All right, we'll see how this thing works. Would you pay attention, please? We'll see how this thing works out. Okay, still to come. We got the $1 Million Quartet performing. All right, we've been having this liquid nose job going on during the course of the show of this hour. Let's see how it works out here.
Steve, it really is pretty dramatic. So this is the before shot about 40 minutes ago of Kendra. Dr. Stanley Jacobs used basically liquid fillers to change the shape of her nose, get rid of that divot, lift up the tip, and now look at the after. Do you see? Can we see a side by side?
Let's do them side by side so you can see. how
See, that area right there is now lifted up.
completely lifted. Yeah.
Look at that right there.
Oh my God.
That is all. I mean, this was just done. Doctor, go ahead and tell us.
Yeah.
So yeah, she looks great. That worked out well. So
She's happy, we're happy.
you can smile. So what happened was that the support structure of the nose, these sort of columns through here, was weakened in we call the philtrum and then the columella. So I supported that and lifted. So that angle between the nose and the lip, see how that's lifted?
See, this before was going down.
It's going
Now
down.
it's kind of going
And
up.
that gives you a younger appearance.
10, 15
right
years
away.
younger, boom, just like that, boom.
And then you put-
the smoothest, so everybody wants to have this, like imagine a line that comes down through here and then gracefully comes down through the nose. And look, that's what we wanted to get back, that graceful sort of balance to the nose.
Instead
and
of
then,
the swoop.
That is
and swoop,
completely
and also
smooth.
through here, we call this the upper lateral, lower lateral cartilages. They were a little uneven after previous work done, so we want to just even that out to make it a beautiful, smooth contour.
Oh, Dr. Stanley Jacobs.
You did a good job.
Fantastic. You doing okay, hon?
You happy?
Kendra?
Once you get your makeup on, you're going to be great.
Wow, we'll be back. Great job. Thank